are at the brink of a way of computerizing and integrating all of these instruments in a much more seamless, in a much more real-time way. So that's the vision that we're working towards in the United States from a governmental point of view, and many in America are working from an entrepreneurial point of view. So with that, I'd like to turn it over to Mr. Amandeep Gill, who is on video. So if we can tee up the video. Mr. Gill is the UN high-level panel on digital cooperation, and I saw him on video before. So can we get the video? The next speaker. Nobody said real time was easy. There we go. Mr. Gill.
Thank you very much to the two co-chairs for introducing this panel, and my sincerest gratitude to Love Agarwal and his team, the Secretary Health and the Honorable Minister, for putting this together and for giving me the opportunity to share some thoughts on behalf of the Secretary General's high-level panel, co-chaired by Melinda Gates and Jack Ma. In the morning, you have heard excellent examples of how digital technologies can re-energize healthcare delivery through telemedicine, through personalized patient care, through electronic health records, and the data that can be aggregated and then used to drive systems, decision support systems, and patient care systems. I want to focus a little bit on the non-technology related aspects of these issues, the policy aspects of these issues. For example, there is the challenge of delivering low-cost healthcare to all those who are not served by the existing systems. This is a challenge in India. This is a challenge in most of the developing world. And digital technologies can help us to scale healthcare delivery and deliver healthcare solutions to patients that have not been served well by the existing systems. In the panel's discussions with governments around the world, with different stakeholders, with CEOs of companies, with civil society, we've come to the conclusion that the international community needs to rally around the following 7 action points. And I would like to share them with you and hope for some discussion around a few of those. Number 1, there is a need to move away from tools and solutions for single diseases, for example, fix malaria or fix tuberculosis, to solutions that help improve the whole healthcare system and ensure that benefits are equitable across the population. Second, there is a need for national governments to ensure that digital is an integral part of the national health strategy and the national healthcare system. So treating digital as a horizontal capability, not as solutions for particular problem. Third, using technology, using digital tools in a way that empowers both the patient, and Dr. Tucker, you spoke about that, but also the healthcare worker. So if the ASHA at the end of the chain does not feel empowered with the tablet in her hands, then we are missing something in the use of technology. So empowering community healthcare workers, connecting them with the center, with the doctors who in higher level care centers, that's an essential part of our thinking. Fourth, we need to create a sense of urgency and incentives to foster cross-sectoral collaborations. Dr. Amitabh Kant mentioned how health today is not only about medicine and how health data is increasingly all kinds of data. So we need cross-sectoral collaborations around the big challenges of today, non-communicable diseases, the burden of diabetes, for example. And then at the international level, we need a global framework for regulation, for bringing in ethical approaches into management of patient health data, for example. We need a global framework for collaboration around data, so incentives for countries across the globe to share data so that that data can be used to drive global solutions. We also need common standards, and I'm glad that there was a mention of some of these standards. There is still too much fragmentation in terms of the softwares that are used across hospitals, 30 plus softwares in most hospitals in the world, and there is still fragmentation in terms of interoperability and a common standard. So we should drive that harmonization process in a strategic sense. Then I think the most important insight that I want to share today from the panel's perspective is that we need some moonshots. We need one or two global projects that help governments across the world sit up and take notice of the power of digital in health systems. These moonshots could be around issues such as mental health, Alzheimer's, for example. These are relatively less controversial in regard to sharing of data. There is less commercial competition in some of these spaces. So if we can build a system that sits perhaps in the WHO, where a set of data points, 9 to 10 data points, can be used across the globe to aggregate data, and then the analytics are done at through a partnership, public-private partnership that's global, that's inclusive, and then the results are shared across the globe as a public good. That would help us take the discussion to the next level. So I want to conclude by thanking the organizers once again and appreciating the immense work that India is doing with these schemes and with the health stack built on Aadhaar. These are models that can be replicated across the globe. Thank you very much.
All right. Thank you, Director Gill. Next, we